Good morning, students. I'll be taking a class on medication administration. Now, let me start off with what do we mean by medication. All of us, we use the terms like medication, drugs, okay? But we need to know what is the exact difference between medication and drugs. Medication is actually a chemical substance, or it is a substance which is mainly used for curing, for diagnosing, as a treatment, or providing relief to a patient who is suffering from a disease. That we call it as a medication. Right? So medication is a substance administered for the purpose of diagnosing, curing, treating, or for providing relief to a patient who is suffering from the symptoms of a particular disease. That we call it as a medication. In some versions or in some books it says that medications are drugs which are used for treatment, for providing cure, or for providing any relief. Okay, so there are different versions. So we say that these are chemical substances, or these are drugs which are mainly used for treatment, curing, treatment, or for symptomatic relief of from a particular disease. Now, what do we call as a drug? Drugs are actually the chemical substances or the compounds which are present, or the compounds which we use, or the chemical substances that we use for making a particular medicine. That we call it as drugs. Now, all medications are drugs, but all drugs are not medications. Now, why do we say, but still we say medications are drugs, but why drugs are not medications? Now, if you see the definition, or if you visualize the definition, I said medications are drugs or substances which are used for treatment, which are used for a diagnostic purpose, or for curing purpose, or for providing any relief to a patient who are suffering from symptoms of a particular disease. But drugs are not medications. You might have heard about taking heroin, morphine. Okay, these are drugs, but they are not going to. Morphine would be used in some stage, but under precaution, or under the strict vigilance, the morphine drug will be used. Okay, but all the drugs are never considered to be medication because of these purposes for which we go for administering the medications. Alright. Now, what do we mean by pharmacology? Now, pharmacology you'll be studying in your second year of your BSc nursing program. So, pharmacology is a study of the drugs. Okay, the study of the drugs. It's not only the drugs we are going to study, but we will be studying the effects that will be produced by the drug within the body. That we call it as a pharmacology. Alright, so pharmacology is a study of drugs and their effects which will be produced in a body once the drug is taken, or once a medication is taken. That we call it as pharmacology. Now, what do we mean by prescription? Almost all of you might have come across prescription. You know what is a prescription. When we go to a doctor, they give a handwritten form of what we need to take, how we need to take. Okay, so all the details will be present. So that we call it as a prescription. So it is a written direction for the preparation and administration of a medication. That we call it as a prescription. Now, there are certain drugs, okay, which we have to buy only with a prescription, and those drugs which we don't require to buy with the help of a prescription. Now, for example, initially antipyretics, like medications which are given for treating the fever, that we call it as antipyretics. Example is tablet Dolo, we have paracetamol tablet, injection mole. Alright, now this medicine we could go and we could approach a pharmacist and we could get it without any prescription. So these kind of drugs we call it as OTC drugs. OTC drugs, over the counter drugs. So over the counter drugs, they do not require any prescription, whereas there are certain set of drugs or medications which you need to get a prescription so that its misuse will be avoided. Alright, for example, the antipsychotic drugs. These are the drugs which we give to a patient who are suffering from mental health disorders. Now, simply we cannot go and prescribe a medicine or take it from the pharmacist because it holds a lot of side effects. Alright, so keeping those in view, there are certain medications which have to be issued by a pharmacist only with the prescription from the doctor. Alright, so that I gave you as a special example because when it came to prescription, I thought this would be a beneficial to you. Now, what are the purposes for administering medications? When do we go, or what purpose does a medication do? Like in the definition, one thing is for a diagnostic purpose. In order to diagnose a particular disease, we need to go for using sometimes certain drugs. Okay, so one purpose is diagnostic purpose. Second one is prophylaxis, to prevent the occurrence of a disease. Sometimes when a person goes on a tour, okay, if their particular area is prone for a particular disease, they will be given with the prophylaxis which they have to take it before, so that when they go there, they will be protected. Alright, so prophylactic purpose, they go for administering the medication. Thirdly, for a therapeutic purpose. Therapeutic purpose, the person will be suffering from a disease, so the medication will be given for that. Okay, and the patient will be relieved of their symptoms and they get cured. That you call it as a therapeutic purpose. Okay, the purpose for which the medication was given. Okay, so that it carries out its intended use and patient recovers completely. That you call it as a therapeutic purpose. Now, uses of drugs. What I discussed was purposes of medication. Next one is uses of drugs. So, the first use is for the prevention. Okay, to prevent a particular disease. Now, for example, filariasis. Okay, filariasis nowadays, they go for dispensing medication to keep filariasis under control. Alright, so it is a prevention aspect. They go for administering DEC tablet and albendazole tablet, which is a part of the prevention aspect. Alright, so one is prevention. Even another classical example is administering polio medications, polio drops. Alright, so that also is a form of prevention aspect, so that the children will be protected from developing poliomyelitis. The second purpose is for diagnosis. To identify a particular disease, they go for using a medication. Like for example, you might have heard of Montil's testing, okay, which we use it for tuberculosis. Okay, a tuberculin test, we say. A tuberculin test will be carried out on a patient to detect if the patient is having tuberculosis or not. Alright, so for a diagnostic purpose. For suppression, we use it for in case of treatment of cancers, okay, where we go for using chemotherapy or we go for using radiation therapy. Alright, so what it does is it will suppress or it will reduce the cancer, or the spreading or the progression of the cancer will be suppressed. Okay, and the cancer cells will be killed or it will be destroyed. Alright, so that we call it as a suppression. It suppresses the signs and symptoms and prevents the disease process from progressing. Alright, so for that particular use, we have with the medication or with the drugs. Next is for treating. So if a patient comes to a hospital with a particular signs and symptoms, and after their examination and investigations, they find out the particular disease. Okay, so for treating that particular disease, you go for administering medication. For curing, okay, that means to completely eradicate of the disease, we go for using it. Like for example, antibiotics, usage of antihelmintics. Okay, antihelmintics means to treat or to prevent worm infestation. Okay, antihelmintics, these are group of drugs which will be it will be killing the worms, and it will be expelling the worms from the body. Example is albendazole, a commonly used drug which all of us know. Okay, albendazole, it comes under the category of antihelmintics. Then enhancement aspects of health, to maintain or to keep your health in a stable way, that you call it as an enhancement aspect of health. For example, you go for administering vitamin supplements, mineral supplements. Okay, after a particular age, like elderly people after the age of 45 years of age, you advise the members to start taking calcium supplements. So all these are enhancement aspects of health. All right. Then moving over to the legal aspects of medication. Okay, now legal aspects means what are the laws under which we are entitled when we are involving with medication, with its dispensing and with its administration. So those things will be covered under legal aspects of medication. So first and foremost thing, being a nurse, we need to know that when we are prescribing, when we are dispensing means when we give the medicines, when we are dispensing, when we are storing the medications, like in case of the wards of the hospitals where you go for storing the medicines, as well as in administration of medications, all these are binded by the law. Secondly, Dangerous Drug Act 1930 and the Narcotic Drugs and Psychotropic Substances Act 1985, they say that the use of special drugs like narcotics, example like morphine, pethidine, cocaine, etc. And these drugs have to be used only with the prescription, or these drugs have to be given only with the prescription. Even dispensing also comes under that. Okay, it has to have a prescription, only then we have to go for dispensing, even for administering or even for storing also. Then it should always, these kind of dangerous form of medications, it has to be kept under lock and key, and it has to be kept under the strict supervision of the senior nurses. And very, very important, the nurses should always keep in mind or bear in mind that they are responsible for administering the medication. So any medication error happens, the nurses will be held responsible. Okay, so these are the important legal aspects of medications. Moving over to drug nomenclature. All of you might be common with the word nomenclature. You might have studied in science, but same here, the drug also has a nomenclature. The first one is chemical name. Okay, chemical name. Any typical organic name that precisely describes the constituents of a drug. When you take a medication, when you look back, okay, you have, it says this particular drug contains, and they start listing out the chemical substances. That you call it as chemical name. For example, N4-hydroxyphenyl acetamide. This is the chemical constituent present in paracetamol tablet. The second name what we have is generic name. Generic name will be given by the manufacturer who first found or who first developed the particular drug before it becomes officially available in the market. The third one is official name. Official name, like for example, through which it has been brought up, or which company it has marketed that particular drug for the first time, or the drug or the company which is responsible for preparing or for manufacturing, that will be considered as official name. For example, you might have seen USAN. It will be there at the end of the particular medication, which particular company is responsible for its manufacturing. So you might have come across USAN, that is United States Adopted Name. Then there is another one like JAN, Japanese Accepted Name. So these are the different ways the particular drug will be considered under official name, which is mainly given or which is mainly carried out by the company which is responsible for manufacturing the drug. Then classification of medication. How do we go for classifying your medication? One thing is based on the body system on which the particular drug will be targeting its action. So based on that, we go for classifying the medication. For example, you will come across cardiovascular drugs, respiratory drugs, even you will come across nervous system drugs, CNS system drugs. Okay, so which part of the body it carries out its particular action, based on that the drugs will be classified. Then based on the therapeutic uses of the medication for carrying out, like for example antihypertensives. Okay, antihypertensives, these are the drugs which will be given for treating increased blood pressure or for treating hypertension. So for treating that particular hypertension or that particular health issue, that we call it as a therapeutic purpose. So based on the therapeutic usage of the particular medicine, the drug will be classified. Then based on the disease the medicine is used for example, anti-tubercular drugs. These drugs are used for treating tuberculosis. So for which disease we go for using, based on that, the particular medicine will be classified. Then based on the action of the medicine, okay, for example, I said antihypertensive. Antihypertensive, again you have classification or categories based on which it carries out its action. For example, you have calcium channel blockers under antihypertensive. Then you have angiotensin inhibitors, okay, enzyme converting enzyme inhibitors, okay, so ACEI, okay, angiotensin converting enzyme inhibitors. So these are all coming under the antihypertensive. So what action it basically carries out, of which part or what it does in the body, which function it alters, based on that it will be classified. Then based on the overall effect of the medication, that means when you give a particular drug, what happens to the whole body, that you call it as a based on the overall activity of the medication. So for example, you might have heard of sedatives, like when you go for giving sedation. Alright, so overall effect produced by the medication. So based on that also, medications will be classified. So I hope you have understood the class. Till then, take care.